Good afternoon, everyone. Hope you're all doing well. Thank you for joining us on this webinar today. My name is Charmaine Jackson, and I head up the training team for Ardens, and I'm also joined by my colleague David Dover, who is one of our training specialists, and Georgina Ford, who you probably know now if you've been to quite a lot of our webinars. Georgina is our team leader for our support team. Now, for this session today, we're going to be focusing on Ardens Manager, which is our population health tool. And we're particularly going to be looking at how you can manage demand and capacity. So this is going to be helpful whether you're an EMIS practice or a System 1 practice. It's still going to be helpful for you. Hopefully, most of you are Ardens Manager subscribers already. But if you're not, we'll give you details on how you can sign up for a free 1-month trial. Doesn't matter whether you're practice, PCN or an ICB staff member, you're all still going to get something out of today's session as well. Now, in terms of housekeeping, again, you might be quite used to our standard setup for our webinars, but you're not connected to a camera or a microphone. So if you do have any questions that you would like to answer us, then please use the Q&A section and you'll see the button for that on your Teams functions. Now, another feature that I keep mentioning in these webinar settings, because I think it's really useful, there is a button that says pop out. And if you click on the pop out button, what it will do is it will allow you to just focus on the screen that we're sharing. And then it puts the other screen with all of our faces on it and all of our initials and all of the Q&A into another screen. It's really helpful if you've got two screens. It just means that you can have more visibility of what we're showing and what we're demonstrating. So if you can find that option, it might be worth just clicking on that so that you can see it a little bit better. Now, this session has been scheduled for 1 hour. We will keep to that time as much as possible. The session is going to be recorded. So what we'll do is we will send out the recording to everyone that's registered on the webinar, and we will put it on our webinar library as well so that you can refer back to it. It never expires, so you can keep coming back to it as much as you like. You can share it with your colleagues as well. And if you are having any audio issues at all, then we normally recommend if you rejoin the meeting, that normally helps. But remember, the session is going to be recorded as well. Now, in terms of today's session, I've mentioned that we're going to be focusing mainly on our Ardens Manager product, and that is our population health management tool. And what that does is it allows you to be able to monitor, to help with your delivery, to be able to track progress in different primary care areas such as contracts, such as conditions, such as vaccinations. And I'll talk a bit about what you can use it for in a minute. But what's really good about Ardens Manager is it allows you to see up-to-date data, and you'll be able to see what's happening in your organisation as part of a practice, but you can also see what's happening across PCN and what's happening across an ICB. So it's giving you greater visibility and an understanding of what's happening with your population and helping you understand that the health that they may need, the care that they may need, and helping you to plan that accordingly as well. So it gives you better access. It allows your patients then to have better outcomes because you're on top of what's going on. It can help you to really maximize your finances and improve your efficiencies as well. Now, the dashboards that we're going to be focusing on today, because we've got two packages as part of, two main packages as part of Ardens Manager, national contracts and local contracts. Everything we show you today is part of our national contract dashboards and our national contract package. So you have to make sure that you are subscribed to that. You have to be an Ardens clinical subscriber in order to use Ardens Manager, so that's a requirement as well. But if you're not too sure whether or not you are part of national contracts then, or national dashboards, sorry, let us know and we can find that information out for you. If you know that you're definitely not signed up for it, then you can sign up for a 1-month free trial, and I will get G to pop that in the chat for you so that you know how to sign up for it if you want to after this session. So good to remind you about features, because some of the conversations that we've been recently having with our customers is they're not using the platform to its full potential. And there's over 20 different dashboards available for you. And we've got some really good features to help you really fully maximize those areas. So your data is automatically uploaded every single day. So there's no admin work there. You don't have to upload it yourself. Every day you come on, you're looking at a fresh set of data, which is really good. It also allows you to be able to benchmark activity across organisations and to help you further break down that information. So not just this is my population, but understanding what their demographics are, understanding what your workforce is like to meet the demands of those patients. And we'll speak a lot more about that in today's session as well. Not only is it giving you insights, it's also allowing you to use it as a planning tool. So you can use our assign and comment option to really help with planning and delivering the care that those patients need. It includes rules and code sets as well, so you'll be able to see exactly what coding needs to be captured in order to meet the requirements for those patients. And you can monitor your trends and targets over time. So for some areas, you may want to see an increase in your trends. In some areas, you may want to see a reduction in your trends, so such as case finders, you always want to make sure they're low, or your safety alerts, you always want to make sure that they're low as well. And last September, we introduced patient level data. So now you've got the full story, not just this is the number of patients that meet this report, but actually who those patients are, providing you with patient lists so that you can be able to go away and be able to action the work that needs to be done with those patients. And we'll talk a lot about patient level data today as well. Now, we are very much going to be focusing on demand and capacity today. But you can use Ardens Manager for a number of different solutions. So you can use it to help you with your contract delivery, whether that's national contracts such as QOF, such as Network DES. You can also use it for your local delivery as well. So if you are interested in us helping you to manage your local requirements, then please get in contact if you're not using it already. We can help you with your disease prevention. So preventing multiple diseases for patients, being on top of the care for the long-term conditions they have, medicines optimization, referral management, and also vaccination delivery as well. So as we come up to the flu season, it's certainly something that you should be thinking about. Now, just looking at what we're focusing on today, which is demand and capacity, we know that there is a real challenge in this area. We know that there is now more and more patients that you're needing to see, which means that some of these patients can be quite complex, and there are really high expectations to ensure that you're delivering the care that those patients need. And at the same time, when it comes to your capacity, even though that there's been an increase in the work that you need to do, you're still facing workforce shortages, you're still facing burnout, you're still facing inefficiencies. So where Ardens Manager comes in, it kind of helps with that bottleneck. First of all, from a demand point of view, it really, and I can't stress that enough, it really helps you to understand your population a lot better. It allows you to be able to look at the long-term conditions your patients have so that you can be a bit more proactive and making sure that they're coming in when they need to. And that's then preventing them from having more complex conditions or multiple conditions in the future. We can also help you keep on top of your medicine management. Those patients who are on medication, are they using it properly? Is it preventing things like side effects and also polypharmacy reviews? And we're going to cover some of these dashboards today. And from a capacity point of view, we're helping you to visualize how you're using your appointments. Are you using them well? Is there any improvement that you need to do? Allowing you to see where your delays are. So how long are your patients waiting for? Is there any wastage? So how many DNAs are you having over a period of time? How are you actually utilizing your staff? Are you using your additional roles when you should be to free up your GPs for more complex things? So we really help you to visualize that information. And also your high frequency patients and your complex patients, how much of a demand is that having on your practice? We'll be able to share that data with you as well. So really the outcome is if you're using Ardens Manager, hopefully it'll be fewer patients and less complexity because you are looking at it at a more proactive point of view, and also helping you with optimizing that delivery and looking at that workforce usage as well. So I'm going to stop there. Hopefully that's given you kind of a good introduction on kind of why we're doing it and why we have these dashboards in place for you. I'm going to pass you over to Dave now, who's going to take the main bulk of the session today. So over to you, Dave.
Thank you. Thanks, Charmaine. First thing I am going to do, everyone, is I'm just going to switch my camera off because, as you can see, I'm one of those people who talks with their hands. So just to save from distracting everyone, I'm just going to pop my camera off. We'll pop it back on at the end when we have got sort of time for questions and so on as well. So I'm just about to share my screen, everyone. So there may be a slight delay. Taking you to the Ardens Manager login screen. So most of you obviously fairly familiar with this, but all you need to do, open up your browser, navigate to app.ardensmanager.com, takes you to the login screen. Essentially, you've got two ways to log in. We'd always recommend logging in with your smart card when you can, because as Charmaine alluded to earlier, we now have patient level data within the platform. So by logging in with your smart card, you are able to drill down to patient details and then, use those details to do whatever you need to do within your clinical system as well. So I'm just going to log in with my smart card. This is just a test system, everyone. So all of the data you're seeing is just dummy data in a dummy practice. Obviously, it's not going to reflect the workloads that you have personally. But the first thing I just wanted to do, everyone, before we actually get into the appointments dashboard, is just introduce you to one or two dashboards that have been there for quite some time, but again, in our experience, we know that not everyone utilizes these to their full advantage, really. Mainly today, we are going to be looking at the services icon on the left-hand side there. So first of all, we just want to touch on getting an understanding from your point of view as to your practice, your population, and also your disease registers within your population as well. So one of the dashboards I just want to jump onto first of all is go to services, down to population. Now again, just based on what Charmaine was saying earlier, all of this data is being uploaded into your Ardens Manager on a daily basis. So to a certain extent, yes, you may want to run reports in System 1, reports in EMIS Web, but just by logging in, I know what my practice breakdown is like right here, right now. So when I'm looking at those age ranges, I can see where there has been those increases, I can see where there's been those decreases. But if we're thinking about demand for appointments, capacity, patients seeing the right people at the right time, then looking at your overall population needs can give you that bit of a heads up as to, what problems you may face in the future. Obvious examples of that, as you can see on mine, for my children here, it has increased quite significantly. So if we do register new families, new children to the practice, as a practice, what does that mean to me? It obviously means we're going to need more nursing time for things like childhood immunisation clinics. Have we got the correct skill set within our practice to deal with that uptake, to deal with that uplift in workload as well? So just at a very quick glance, I know where we are with all of these age ranges within our practice. Again, I guess it goes without saying really, but if there's been that sort of increase in elderly patients, what does that mean to my practice? Does that mean inevitably we're going to have to do more home visits? If that does, is there a way that we can tap into any of the community resources to help alleviate those pressures as well? So without having to do anything in System 1, within EMIS Web, I know exactly what my practice looks like at this point in time. So based on today's data when it's being uploaded. Again, there are various other things on here as well. So if I scroll down the list, obviously it's going to break it down by gender and so on. Got your activity, your births and your deaths for last month. So again, maybe something that you keep an eye on as you go forward. But more about when it comes to planning, when it's looking at the services that you provide, do you have the capacity? Do you have the right skill set? Do you have the clinicians that are going to be needed to perform all of these tasks as well? So just by looking at the overview of your population, gives you that snapshot, maybe informs you of, yes, we do need to maybe consider, do we need more nursing time? Do we need to employ a new nurse? Whatever the case may be. So it's just giving you that information that you need at your fingertips here and now. Another one on here, which again, should be used in my humble opinion regularly, but not always the case. But within that population menu, you've also got your disease prevalence. Now, you may go online to those national GP contract databases to look at your own prevalence against other practices within your PCN or within your ICB and so on. But again, based on all of that data that's being extracted from System 1, from EMIS Web, it's uploaded into here on a daily basis. So when it comes to disease prevalence, again, what I'm going to be looking at is, are there any increases or significant increases here? And again, do we have the capacity as a practice to manage all of those annual reviews, interim blood tests, and whatever else is going to come your way based on these patients' disease registers as well? So from a prevalence point of view, Again, at a glance, I've not needed to go anywhere. I can see exactly where we are. Again, if we've had those huge increases, how does that translate to our practice? How are we going to cope with that increase in demand, and how are we going to provide that capacity as well? So first one was just that services population for your overview of your age ranges, along with your disease prevalence as well. Okay. Now, obviously, with the likes of QOF this year, there has been those areas of QOF disease registers that are being retired. So, you know, to a certain extent, you could argue, I don't think many of you would, that there is, you know, less to do in that area. But, you know, you've still got all of these patients that do need care of some shape or form as well. What you also have within those services dashboards, if I just go back to the left-hand side there, is you also have a conditions series of dashboards based on, as you can see, cancer, CVD, diabetes, and so on. Now, again, just to sort of prepare yourselves for what is to come, what we may need to factor in when we are configuring our appointment book, when we are deciding which members of our team are going to be responsible for doing those annual reviews, doing those interim blood tests and so on. I just wanted to pick out the CVD one today because obviously there's been quite a large focus with QOF this financial year. Lots of sort of resource put into CVD above some of the, not above, but in place of some of the registers that have been retired. But again, based on the fact that you know what your population looks like, you know what your disease prevalence figures are like, you go back to the services, go to conditions and go down to cardiovascular. Then again, along the very top there, it's going to break it all down, EF, CHD, heart failure, and so on. So again, as a practice, I can dip into each and every one of these as and when I see fit. So if we looked at hypertension, for example, know what our register looks like. We know what the numbers are like with new diagnosis. If I do, like Charmaine mentioned earlier, want to drill down into that patient level data. Again, I'm going to give you examples of this, especially when we get onto the appointments dashboard. But if I'm looking at those new diagnoses in the last 12 months, as long as I'm logged in with my smart card, I can view that cohort of patients. This is what we mentioned earlier in and around benchmarking. So what we get with benchmarking is a national average of all Ardens Manager users across the country, along with all of the practices within my PCN. Again, if you're looking at this from an ICB level, you would have the data sharing agreement to drill down to sort of individual practices across your whole patch as well. But more importantly, from sort of September onwards last year, you've had the ability to see who those patients are. Again, this functionality transferred all the way across all of the various different dashboards within Ardens Manager. So I've got that list of patients now. Various things I can do here. If I was interested in maybe, you know, reviewing that patient's record just out of interest, then we do have the ability to copy their NHS number and then go into System 1, go into EMIS Web, paste that NHS number, review that patient's record and decide what, you know, best course of action is and so on. While I am here, I'm just going to give you a little bit of a heads up as to an option that is going to be released in the very near future. We are actually just going to replace that copy NHS number icon with a direct link to your clinical system. So in the not too distant future, copy is going to be replaced with an open option. You'll click on open, it'll log you into EMIS, log you into System 1, have that patient already selected. Along the very top here, again, across all of these dashboards, whether they be conditions, population, QOF, appointments, you've then got a demographic breakdown. So you can see all of the demographics based on age, gender, ethnicity. You've got your health inequalities in here as well, your core 20+5, health, multiple deprivations, and also any other conditions those patients may suffer from as well. Okay, so you've got all of that information that you can drill down to. If you do, at any stage, using any of these dashboards, want to target certain cohorts of patients, it even gives you the ability to do that as well. So of these 50 patients newly diagnosed in the last 12 months, maybe I'm interested in those over 80s or the 70 to 79-year-olds. Then what I can do based on the demographics is use that filter option, and then I can mix and match. I can choose as many or as few of these as I want to. So if my priority happens to be a particular age range, I can choose that. Again, I can add to that age range. It doesn't just have to be 70 to 79s. I could do the 50 to 59s along with the 60 to 69. So I can pick and choose as many of these as I want. Choose gender, male or female. And obviously just continue to narrow that field down if I want to. So out of those 50 newly diagnosed, if I'm interested in those 70 to 79, making sure that they are being seen and cared for by the relevant members of my team, then I could filter that information out, apply that filter, and of those 50, I'm now down to 9 patients. Again, just sort of functionality that you've got with an Ardens Manager, again, across all of these dashboards now. Got the ability to export that data. So if I wanted to export, 2 options I've got, either as a CSV. Now, CSV is the format that your third-party text providers use, so the likes of iPlato, the likes of Accurix. So if you wanted to invite these patients in for a review of any kind, then again, I can do it very quickly, very easy, just using the Ardens Manager platform. I've filtered out what I need. These are my priority. I'm going to export that as a CSV. And obviously what I could then do subsequently is take that information, that list of patients, into Accurix, for example, and batch invite all of those patients in to see the practice nurse, to have their bloods done, whatever the case may be. The alternative to that is under that export option. You'll see for me, this is stating EMIS Web or import into EMIS Web, because my Garden View test practice is set up as an EMIS practice. Obviously, if your system one, it's going to default to that. So here, I could import or export that list from here, import it directly into EMIS Web, and then if I wanted to, I could maybe mail merge and send out an invitation letter to those patients. I could print that list off. I could give it to one of the reception team for them to book the appropriate appointment with the appropriate clinician as well. So all of that functionality that you've just seen, I will go through again as we go through the appointment side of things, but just allows you to prioritize those patients if you need to. So within those conditions, looking at CVD in particular, know what the register looks like, know what the new diagnosis have been in the last 12 months, the last year. Again, we have things like safety alerts on here, just highlighting the fact that we may need to consider starting anticoags for these patients as well. We've got case finders, not to go into too much detail, but these are patients who are not on the atrial fibrillation register, although they do have an indication on their record somewhere that they probably should be. So they've had a particular code added, whether it's someone's done a review or they've done monitoring, but they've never actually diagnosed and placed that patient on the register. Again, could lead to extra appointments if that patient's not being well controlled and reviewed as they should be. And then a little bit further down, of interest, you've got all of your performance indicators as well. So maybe a slight crossover with some of your QOF points, your QOF indicators. But again, as they practice, I know that, out of the 142 eligible patients, 113 have had the BP, 29 still outstanding. Again, I'd want as much green as possible on here. And again, I maybe question, if we're doing all of these things as part of reviews, should we not be doing height and weight at the time that we do the BP? But obviously in my practice, we've not actually done that. Again, another little tip on that one is anytime you go to any of those view options, you can see who the patients are. So 29 patients outstanding here. So 113, as you can see, with the green tick. We've achieved them, coded correctly, got the BP in the records in your clinical system. But what I'm interested here is identifying those patients who've not had the BP, so we can recall them. Maybe again, we can send them a text if they are doing home BP readings as well. So what I'm going to do, a little bit more functionality, rather than use all patients, I'm going to change that to show remaining only. And again, there's my list of AF patients who've not had their blood pressure checked or recorded or coded correctly. And I could be using that list to filter, to prioritize, or I might get to the point where maybe these patients do need an invite. And again, if I'm using Accurix iPlato, I can get them invited very, very quickly and easily. So those conditions dashboards, especially with the likes of the focus on CVD, could help you out, just identifying patients and also looking at potentially what work is outstanding, what does need to be done, and how you're going to direct those to the relevant clinicians as well. Final little one on here before we get to the appointments. Just wanted to highlight the prescribing dashboard as well. So very useful, not just clinically for your partners, your GPs, practice management to be aware of, but you may consider that the ideal team to deal with these kind of things could be your pharmacist team, if you have got the luxury of having pharmacists attached or employed by your practice. So going to prescribing, again, there's lots on here, but just a few things to point out. So we've got all of these alerts that maybe need actioning. So it is patients who, potentially we need to reduce dosages. If we're not doing that, again, is that giving us, greater demand on appointments when they're not using the correct medication, they're not sticking to the correct regimes and so on. So again, I've got all of these alerts built in directly. I've not had to write any reports in System On or EMIS Web. I've got that information directly from my clinical system. It's even telling me, when patients are on particular sort of areas of care, what needs to be started, and I guess is equally important, what needs to be stopped as well. So within here, there's lots. But a couple of little areas I just wanted to pop into. So from an optimization point of view, again, you might be looking at your drug reviews, your safety alerts. So again, we're hopefully preempting those patients who aren't sticking to their medication regimes. They've not been informed of, a new medication that they should be offered. So again, we could be looking at these patients who need to start an anticoag. Again, I'm not going to go into all of these very same options again, but if we go to view, we can see who the patients are, and again, we can start to use those demographics, start to use those filters if we need to. So again, just preempting sort of appointments that may occur in the future because patients aren't using their medication correctly, or something's been missed along the line, I guess. But again, just all of those safety alerts broken down by each particular sort of area as well. So you've got all of that work that potentially could be done to, to combat patients coming in for appointments that may be unnecessary if we got them in line with the medication. And then also you've got, like sort of your workloads in here as well. So from a reviews point of view, again, are we looking at, activity that we did last month? So how many med reviews we've done, how many structured medication reviews we've done, and again looking at the likes of, well, structured medication reviews, I've only done one. Obviously, return on investment if you are employing pharmacists directly and so on. But if I looked at that, not saying that we've not had patients who've had med reviews, structured medication reviews done, but one of the things that a lot of this is all built on clinically is all of the SNOMED, the read codes that you hold within your clinical system. So it's not to say, SMRs have not been done, but again, if my dashboard's reflecting the fact that we've only done X amount last month, yet we employ pharmacists to do, half a dozen sessions per week, good return on investment you need. So again, I can be looking at all of these demographic breakdowns and so on, but this little tab in the right-hand corner, far right-hand side there for rules is just going to allow you to see what codes are used for that particular report. So again, looking at all of the different codes that are needed for your structured medication reviews to make sure those patients are being captured. So you may look at these and think, well, actually, we're not doing the work. It's not that you're not doing the work and you're not providing the care. It's more about the fact that the information in your clinical system may not be being coded, certainly consistently or at all. So you've got all of that information in and around your prescribing that potentially you could get your pharmacy teams involved with as well, along with all of those performance indicators in and around sort of polypharmacy and so on. Okay. And now on to the appointments and your demand, your capacity, your uptake of appointments and so on. So again, all from that same area. So the services icon on the left-hand side, we go into the appointments dashboard. And again, what we're going to do, everyone, is go through each one of these, but we'll concentrate on certain areas that are going to hopefully make a difference for you. So when we're looking at the past appointments, again, bear in mind, all of this data is coming directly from System 1, directly from EMIS Web. That's then broken down into activity in the last 12 months. And again, we'll come back to some of these as we go through. We've got activity in the last month based on contact methods, extended access hours, appointments that you may be offering, overviews of all of your appointments, your DNAs, your personalized care, your procedures, and so on. So I'm going to highlight a few of these, and then we'll look at some of the other options, your future appointments, and so on, as we go through. So first on, just starting not so much at the top of the list, but sort of starting and working our way down. So looking at your activity, I'm going to come back to the likes of your DNA shortly and so on, your high frequencies, but looking at your uptake for online booking of appointments. Now, again, you would imagine, sort of pre and post pandemic that, those online appointments may have been more frequently used. They may have been, more relevant at the time. But, as a practice, have we continued in that vein? If not, why not? And if we have dropped down numbers significantly, is that in and around, training within our practice, reception teams being fully confident on being able to discuss, how patients sign up for online access to be able to book their own appointments, cancel their own appointments, and so on. So again, it could just highlight where things maybe have plateaued and dropped down a little bit. There could be some encouragement that you could use with your patient participation groups and so on to get those patients more involved, using their apps, using their online services to book those appointments in as and when they may need to. Again, look at it in the bigger picture. The more patients who are using these online services, the less traffic you've got, footfall in your practice, the less sort of telephone calls you're dealing with on a constant basis as well. Okay. I'm going to come down to a few others on here as well. So looking at your time from booking an appointment to patients actually being seen. Now, again, you'll have those requirements within the likes of your network DARES, capacity and access from a few years ago. So again, hopefully seeing those patients within that 2-week period. But again, looking at those breakdowns as far as which members of my teams are doing the majority of this work, what kind of appointments are being utilized for those kind of things. So if I was looking at those 0 to 5 days, again, by utilizing that view option, say we've got 192 patients, not a great deal compared to what you've got in reality. But if we go to that view option, again, I can see who those patients are. I can look at those demographics. But again, we start to introduce more functionality within the appointment system as well. So if I need to find out, of these patients, where the majority of that workload is being taken up, again, is that something we could look at and then start to maybe think about reconfiguring our appointment book in and around, these patients potentially could have been seen by a care coordinator. They didn't always need a GP appointment, for example. But again, I've got that staff tab, gives me an understanding of where we are right here, right now, when it comes to all of those appointments. What is the makeup when it comes to my GPs, to my partners, to my salary GPs, and so on. So again, I can break that all down and see where the workload is, rather than potentially having to create, 999 different reports and different searches within System 1 within EMIS Web. I've also got information now. This is a fairly new sort of addition to Ardens Manager, where I can see the actual appointment slots and rota types have come into here as well. So again, those patients are being seen within the 5 days. You'd expect that there would be sort of fairly, urgent appointments that people need to be seen in. But again, maybe looking at, when we've got these acute lists, should some of these patients been seen in those annual review clinics or not? Should it been more of a routine appointment that they booked in if it was just for their annual review? So again, at the moment, it's broken down by your rotas and your slot types. What we are currently working on is also importing that information based on the national slot type categories that you should all be using as well. So more information to come into here. But again, just giving you that understanding of when we've booked these patients in within that time frame, what was the demand, what kind of clinics, what kind of rotas, what kind of slot types are we booking those patients into. And again, if it's not appropriate, maybe we do need to rethink, maybe we do need to look at how we offer those services as well. Got your timeline on here. So again, you're 0 to 5 days, looking at the timeline. It's going to break that down. Again, we're looking back in the last month or so. But what you can do, and again, maybe more apparent when we look at the likes of the DNAs, but you can break those all down by date range as well. So again, if you wanted to see from a capacity point of view, which day of the week happened to be that, more demand when it comes to appointments within 0 to 5 days, then again, I could be looking at day of the week. For me, it's that Thursday. I could be looking at weeks over those sort of time period in the last month, and so on and so forth. So again, it's just giving you that understanding, giving you that information that potentially could allow you to make these changes within your practice, within your appointment system, within your appointment book as well. So you've got all of that information in and around that sort of time from booking an appointment to being seen. You've also on here got all of your sort of activity in and around things like care home ward rounds, NHS health checks, and so on. Now, again, just to highlight, obviously, when you look back at network days previously, you had an IIF requirement for care home ward rounds. Again, what does that mean to me in my practice? That means that, looking at this, I've not done any care home ward rounds. That's probably more about how it's been, incorrectly coded rather than anything else. So again, if you're continuing to offer those service requirements that you should be doing as you've signed up for network days, contracts, then obviously it might highlight those discrepancies where potentially patients have not been seen or recorded as being seen if you do ever need that information. Good one on here, and again, it sort of goes back to that return on investment as well. So for me, very low uptake when it comes to NHS health checks done. Now, it may be that I have, invited 100 patients last month. If I've only had one patient coming in for their NHS health check, obviously financially, I'm going to benefit from that in some way. Data is going to be extracted by CQRS and so on. But at the same time, secretaries, part of the management team, they've ran the reports, they've done the invitations, we've texted, we've potentially sent out invitations, letters to all of those patients. But again, if the uptake is very low, it's either going to reflect that, maybe you need to rethink about that invitation process and, what those patients look like. Or potentially, again, if I go to view, and I'm not going to go to the patients and the demographics and so on, but I would be convinced that I've done probably a heck of a lot more NHS health checks than in reality is being shown. But that's always going to boil down to the likes of the coding or the consistent coding that you've got in your practice. So again, for me, that might just be a little training exercise I do in my practice, making sure that, as nurses, as healthcare assistants, they're using the correct Ardens templates, they're ticking the correct boxes with the correct codes in there. So again, it's just telling you what codes are eligible for your payment, especially when it comes to your NHS health checks, whether you're relying on CQRS, whether you've got a local public health contract for that as well. So when it comes to looking at your activity, breaking that down, again, you can see where you are and where you potentially should be when it comes to all of that sort of information that's coming directly from your appointment book as well. Okay. You've got all of your extended access on here as well. So all of your likes of your face-to-face home visits, not a great deal for me, but obviously for you, probably a heck of a lot more. Your personalized care. So again, are we as practices making sure that those red or potentially amber patients are being seen by the correct clinician when they come in? So, you know, hopefully you've got more green than red. But if we do go into the red, then let's have a look at the staff that are treating those patients. And again, is it the relevant staff within my practice who are carrying out those reviews, carrying out those consultations? So again, maybe the green ones aren't being dealt with as much by your partners and your GPs. And again, you'd want that to reflect that when you look at that breakdown as well. Looking at the likes of your DNAs, which obviously could be quite a hot topic for most of you. Again, broken down by that last 12-month activity, that last month's activity as well. Principle's the same. If I go into view, so I've only had 168. Now you may, you know, quite conceivably deal with those DNAs on the day as patients do not attend for their appointments. But if I want an understanding of a breakdown of that, see the patients, see who they are. Quite usefully now, you've also got an activity count on here as well. So looking at, you know, multiple DNAs that some of your patients have had. Again, I can break that down by staff. It may be that I'm wanting to look at, you know, as a practice, if we are getting large numbers of DNAs for especially those elderly cohort of patients, again, do we need to rethink? Do we need to educate our reception team in and around what we should be offering, you know, more home visits potentially, or, you know, nurse visits potentially, that kind of thing. So again, you can break down your demographics in the same way. Of those DNAs, I think what I'd be interested, if I was still working in a practice, is, you know, who is affected by that the most? Which of my GPs, which of my nurses do tend to suffer from DNAs as well? So again, what I can do is look at that staff tab. I can break that down by all of the different categories. So again, by GP, I know exactly now which GP is suffering the most from DNAs. Again, maybe I look at those appointment slots and the rotas, because again, if we are getting DNA patients in particular clinics, particular sessions that we've got, again, do we need to relook at that in the appointment book? Do we need to educate those staff in booking those appointments in if we are getting high returns of DNAs as well? Timeline's a really useful one on here as well. So I know how many DNAs, I know which doctor is being affected or which nurse is being affected by that. Initially, when you look at this, because it is looking back 12 months, it is a bit of a mess, looking at all of these sort of graphs and so on. But again, I would like to know at my practice which day of the week is the day of the week that we have the most DNAs. Again, what does that mean to me as a practice manager? Does that mean I can look at this and think, well, actually, let's just pretend my Friday happens to be my highest rate of DNAs. Does that mean I've now got enough information? Maybe I do need to discuss this with partners and with, you know, management teams in and around your appointment book. But does that give us enough information to think, well, if we are suffering from DNAs on a Friday, does that not give us the ability to maybe remove at least one of those sessions from a Friday and then, you know, add that session to earlier on in the week for one of those GPs when your demand is that little bit greater? So it just gives you that full understanding of who's affected clinically, which member of your team, what kind of appointment slots and rotas they're DNAing in, and also what your timeline is like, whether it be day of the week or month or quarter. Again, put it into quarterly basis. We'd need to understand why, I guess weather plays a part in this, but why, quarter 3 happens to be higher than quarter 1 and so on. So again, just gives you all of the information, allows you to maybe discuss it and make those decisions as well. Charmaine, before I go on any further, I'm just going to stop, just have a quick drink of water and see if there are any maybe questions or anything we need to highlight or share with the wider group.
I think probably just by looking at it all, I'm just thinking from a user point of view, I can see some people thinking, where do I start with all of this? Because it's just so much information that is available, and I would take it slow and I would take it step by step. So perhaps mainly focus on what impact is my patients or are my patients having on my capacity, and starting there and starting to play with the population dashboard first of all to understand their need, and the condition dashboards, and then maybe then come across to the appointment dashboard and then look at your utilization. So I would really take this in steps. Don't let it overwhelm you, because there is a lot of information at your fingertips, but it's just how you use it and how relevant it's going to be for you. Now, remember that we provide lots of free training as well. So if you want to jump onto a call with one of the training specialists to understand how it will work for you, depending on the data that you need, then let's do that, and we'll show you how you can book on to some further training sessions. But no, Dave, not really many questions. It's more around some of the functionality that G has answered as we've gone along.
Yeah. Okay. What I'm going to do, if that's the case, then everyone, I'm just going to sort of take a slight step back into, if we look at those past appointments, you're probably not going to look through each and every one of these, every day of the week. But if we highlight the fact that those DNAs, that might be something you want to start with, trying to reduce those DNA rates. Again, you can look at it from the last 12 months point of view. You can look at it from the last month point of view. So again, seeing how you're being affected by DNAs as a practice, deciding, is there anything we can do potentially to decrease those numbers? You've got things on here, again, there are affect your practice day in, day out. Your high frequency, your frequent flyers, your frequent attenders. I'm sure the majority of you would know, if you've only got one patient who's had more than 40 appointments in the last 12 months, you would know who that patient is, at the drop of a hat. But again, it's maybe trying to think about things in context of, if I've got a number of patients who've had more than 40 appointments, yes, I need to know who those patients are. Maybe I need to highlight those patients to the reception team, because again, those patients may not always need a GP appointment at the drop of a hat. Maybe we can direct them to a care coordinator, to a social prescriber, to one of your pharmacy teams. Maybe it highlights the fact that, that particular person or that particular patient is coming in to see one particular GP. Again, is it just because that GP, is happy to see that patient at the drop of a hat where others wouldn't be? So when you're looking at your frequent flyers, again, it's just giving you the understanding of who that patient is, who they are seeing, maybe even think about, what other conditions do they suffer from? So if they're having more than 40 appointments, if I look at the demographics, then I can see at a glance what kind of registers those patients. So if their asthma or their COPD is not very well controlled, again, do we call that patient in? Do we get them under control, give them all of the help, support and education they need to save them from coming in almost on a weekly basis? So that's probably quite a good one to be looking at. Other things, again, just sort of quickly going down, got all of your activity, got all of your contacts, your extended access and so on. But again, helping you with your demand as such, looking at the time from booking appointments to being seen. An important one on here, waiting times. I guess there's nothing worse from your point of view, from patients complaining about how long they've waited for an appointment, they're still in the waiting room, 10, 20, 30 minutes later. But again, if you want that evidence to report back to your teams in and around, these are the usual suspects. These are the GPs or nurses that potentially are running late. So your waiting times on here, I've got 166 patients waiting more than 30 minutes. Now, again, it's just putting that into context and understanding as a practice, what can we do to alleviate this? Again, if I view, yes, I can see the patients, yes, I can see the demographics, but I'm probably more just interested in which of those clinicians is running, overtime, 30 minutes late regularly. If that is the case, what does that mean to me in my practice? Should we think about, if those GPs are struggling with 10-minute appointments, 10-minute consultations, does that mean we go back to the drawing board and increase their appointment times to 15 minutes, to 20 minutes, whatever the case may be, whatever suits you and your practice? But again, it's just highlighting the fact that, Dr. Sullivan, 18 patients waited more than 30 minutes. There may have been a reason for that, but if that's a regular occurrence, I'd rather see that data now and make that decision now rather than potentially deal with ongoing complaints. So those would be the kind of things, I guess, as Charmaine sort of mentioned, the kind of things that you'd be looking at initially: DNAs, frequent flyers, making sure that, if you are low with numbers on NHS health checks, why is that? Is it just simply because they're not being coded correctly, or is it simply because patients are ignoring and you're not getting that return on your investment? So you've got all of that in there. Again, another one in here just to sort of finish off on this particular screen. But you may have methods of highlighting patients who are on your adult safeguarding register that have DNA'd. Again, that would be a group of patients that you might want to identify, that you might want to work closely with as well. And then you've got all of your sort of performance indicators on there as well. So all of your attendances, and again, those can be broken down. So everything that's on here, maybe baby steps for you initially, but it's giving you all of that rich information that your appointment system holds currently, that you can see in Ardens Manager, that you can interpret and then make decisions on, going forward, how do we combat these DNAs and so on. Along with that, you've got all of your future appointments, which looks forward for the coming month. Again, there's not a great deal on here compared to that previous screen, but again, you've got all of your appointments, your extended, your overview. I'm guessing the likes of in here, you could be looking, if you do have the luxury of unused appointments, again, unused appointments, let's break it down and to see which member of our team is being affected by that, what kind of slot types or rotas are being affected by that, and again, do we need to maybe think about removing those sessions, putting those GPs, those nurses, sessions on earlier on in the week where we've got that demand and sort of greater demand as well. All of your activity that's due next month. So again, important to sort of highlight those palliative care reviews for your reds and yellow patients as well, and so on. All of your contact methods. So again, just breaking it down simply as I possibly can into this is how your appointment book looks for the coming month. And again, you may break that down further into, are there different things we can do as practices, to alleviate the fact that, we've still got unused appointments, yet we've still got patients crying out for appointments on the day. How do we cope with that? So got those future appointments on there. Got your workforce data in here. Now, this is just based on the data that you provide when you go onto one of those online portals in and around direct patient care, full-time equivalents, non-clinical and admin staff at practice level and also at PCN level. So again, it's data that you provide, that you complete as and when you need to. You may do it on a monthly basis. But again, as a practice, you can look at that because this data gets published and you can see what your figures are like in and around your full-time equivalents and so on. So again, within your practice, what the split is like in and around the data that you submit there as well. Got all of your GPAD appointment data on here as well. So when it comes to GPAD, your general practice appointment data gets extracted from your appointment book via NHS Digital, NHS England, and gets published on a monthly basis. And that's just a reflection of all of those, the national slot types that are being reported back on when that data gets extracted via GPAD. And finally on that one, you've got your continuity of care. Again, all of your personalised care in and around your red, amber and greens. And again, it might just be looking at this as, the majority of patients are going to be seen, that are going to be green. But again, when it comes to that personalised care for those red patients, who are the GPs responsible? Are we booking those patients in with the correct patients? Those patients in with the correct clinician as well. And one final little thing, again, maybe information overload everyone, so I do apologize, but final little thing on here is obviously that's looking at your appointments. That's allowing you to hopefully make some decisions in and around your capacity and your demand. But what it also allows you to do is think about how that information is reflected when it comes to things like the GP patient surveys. So your patients who do fill in those surveys that get sent out annually, that get collated by NHS Digital, NHS England and get published nationally. If we go into that services menu again, down to your national data sets, and then within here you've got various things. I'm not going to go into each and every one, but you do have feedback from all of the questions that your patients answered in and around GP surveys, how easy it was to get through on the telephone, website, NHS app. So if you are interested in what those patients who have completed those surveys are actually saying about your practice, then it breaks down each and every one of those questions that's on that survey. You may or may not be interested in that. You may not want to look into that, but it's there for you. It's published data. We just give you the ability to look and break down as to if your patients think either yes or no. It is easy to get through to my practice, to book an appointment, and so on. Again, you can break that all down, let you know of those patients who completed those surveys, what your scores were when it comes to easy, fairly easy, very easy, or not, as the case may be. So just all of your GP patient survey data does form part of your network DES as well, but this is the full cohort of all of those questions that get responded to. And I think that's everything from me, Charmaine. Again, I'm not sure if there were any questions we needed to highlight or.
The continuity of care, it might be worth just looking at that again and putting up the rules tab, because we had a question whether there were any particular coding that should be used. So do you want to just explain that a little bit further?
Sure. Sorry, Charmaine, you broke up.
Into your appointments and then continuity of care, and just explaining the coding and the criteria it's looking for.
Yeah. So with this one here, if you just go to that tab, and you've got all of your personalised care dashboard information on there. But yeah, if you do go into the view option, you do have where you see the rules section, that's based on the coding requirements. So if you do have a look at the rules, second or two to load. So again, you can see the kind of cohorts that's been brought in, your mild, your moderate, your severe frailty, along with your dementia, your palliative care. If you did want to drill down further, you can click on that link for severe frailty, for example, and that's going to break it down so that you can find that particular SNOMED code that is highlighting or identifying those particular patients as well. So all of your rules give you all of the code and requirements that you've got within your clinical system as well. Sorry, Charmaine, is that what you meant? Yeah.
Thanks, Dave. Should I pull up the last slide so that we can just talk about training and kind of close the session? Yes. There you go. Do you want to talk through that?
Yep. So we've mentioned it as we've gone through everyone. So obviously from an Ardens point of view, all of your Ardens training is free. So whether that be for Ardens Manager, Ardens System 1, Ardens EMIS Web, all you need to do is contact us and we'll give you the details in a second or two. Obviously, we run these webinars regularly. They are recorded, so you can always watch them back as well. We also have our Ardens Academy, which is an online training platform, which just allows you to do training in bite-sized chunks at your own pace, at your own leisure. Very interactive, lots of quizzes built into those, and you do get certificates produced at the end. Lots of support articles on our website to supplement all of this. Very dedicated support teams, again, across the business, when you're talking about Ardens Manager or Ardens EMIS Web, Ardens System 1. Quite an active Facebook community as well. So if you are a Facebook user, you can look at, Ardens Manager chat on Facebook. You can join one of our groups as well. And as the next one, Charmaine got the QR codes. Yeah. So those of you, cameras at the ready, you've got the QR code on the screen there. You've also got our email addresses for the various support teams. If you do want to book training, you just need to email training@ardens.org.uk. But that QR code itself will take you to an area of our website, which we discussed on the previous screen, support articles, webinar links to pre-recorded webinars, and so on. So all of that data is based on one screen if you use that QR code, but you do have all of our contact details on the screen there if you do need to get in touch. Anything else you wanted to finish off on, Charmaine?
No, just really, hopefully you found that webinar useful. Please do let us know your feedback because we want to make sure that we're pitching it right as well. Next month, we're going to be focusing on medicine management, so medicine optimization. So if you think that's going to be useful, just keep an eye out for our upcoming webinars. We normally will either put it on Facebook or the front screen of Ardens Manager, or we will send out an email. We appreciate probably Ardens Manager. There's so much that you need to learn. So please do make sure you stay in contact, continue to join our webinars, continue to book in for free training as and when you need it. So Dave, thank you very, very much. Hope you all found it useful. We will stick around if there's any more questions. Just let us know. We can unmute you if you prefer as well. So if you want to raise your hand virtually, then we can unmute you and listen to your questions too. But if that's enough for today, thank you for coming. And it's just the red leave button on the top right hand corner. So thanks everyone and hope you enjoy the rest of your day.